Well, let's talk to Niall Dickson, who's Chief Executive of the NHS Confederation. Hi to you, Neil.
Hi.
Hello, Neil. So I was asking our callers, our listeners, we know what the problem is here because we've heard it over the last week. Enough. What is the answer?
Well, I think the answer principally lies with the government in the first place, and that is to have a really stand-back assessment about what both the health service needs and what social care needs. And so it's not just the health system, it's also the social care system. We certainly believe that it needs additional funding. That's not the answer to everything, but certainly this year the planning actually for winter has been more intense and has been more thought through than in previous years, and yet the reality is this system cannot cope with the levels of demand. It hasn't got the funding and it hasn't got the staff to be able to meet rising demand. And rising demand, we know why rising demand exists. There are a whole series of complex reasons, but one of them certainly is that lots of us are living a lot longer. We have a lot of different conditions that we're living with. Yeah. And we find that those people, if they're not provided with the right care in the community, because there isn't the resources there, they end up appearing in the accident and emergency departments. So that's what you're seeing at the moment. And so we've got a
and that's, as I say,
that
is what we keep hearing. We keep hearing the same things, exactly what you've just said. But is there any solution to the immediate problem? Can anything be done? Because I can't see anything solving this immediately.
No, I think you can't invent staff who don't exist and solve the problem. I think the answer is there may be more you can do using bits of capacity with the independent sector. There may be more that we can ask voluntary sector organisations to contribute. But I think that an awful lot has been done to try and mobilise and get the system to work, and it has not succeeded. The reality is that the system is under too much pressure. So I think that the answer is this pressure will lighten a bit post the holiday period, as it were, going forward. If we don't have too cold weather, which again could knock us off again, then it won't be respite. This system is under pressure all year. So it's not just a winter pressure problem, it's a total year pressure problem. But it may get a little bit less pressured as we go out of the harsh winter period. And I think that is an opportunity for us to reflect on, one, getting our workforce right. That will not be achieved in the kind of timescale that you're asking or asking your listeners to, can we solve this problem now? Well, you can't. You can't invent
an
emergency consultants.
You've answered
you can't invent nurses and so on.
Yeah.
But the answer is...
So is that where the money's going to go? If all this money needs... So Jeremy Corbyn calling for loads of money to be chucked at the problem. Yeah. Where's that money going to be spent then? Where do the NHS want to spend it?
Well, I think a lot of people in the NHS, and it's a real change, and I remember visiting one of our member organisations, and the director of nursing said, listen, if there's more money to be spent, don't spend it on this A&E. Don't spend it here, spend it on social care. And it's really interesting. Now, I'm not saying there is more money needing to be spent on accident and emergency, but the crisis in social care means that hospitals are not able to discharge patients out, so they get stuck in the hospital, and also the lack of care in the community and dealing with problems at an earlier stage means people turn up. So what you're seeing with the accident and emergency departments is it's the visible bit of the iceberg, and it is really intense and very difficult at the moment, and there are patients who are stuck on corridors and all the stories that we've heard, which are absolutely real. But beneath
and is that everywhere?
Of course, we've got... No, I think you'll find there are hospitals that are under more pressure than other hospitals. There are also hospitals, and here's an irony, you can get a hospital which says we cannot take any more patients, and so ambulances then get diverted to the other hospital. That means that the receiving hospital ends up possibly on the government's performance figures doing less well because patients have to wait longer there, whereas the one that has had to divert them gets some relief, which just shows you how some of the target setting can actually result in perverse consequences.
Niall Dickson, thanks so much for joining us, Chief Executive of the NHS Confederation. We've also got John Lister, who's from